and this is 28th November, one of those unique Sunday, and we are very fortunate to have Dr. Balakrishna Shetty with us, and this is one of those frequent CeRIMed talk which we organize. I will be the host for today, and my job is to first introduce what is CeRIMed, and then you'll know what we do principally and who are actually associated with us. And then we'll briefly talk about the speaker. Then you can hear him, and after the end of his talk, you can ask all the questions you have. So with these few words, namaste and welcome to all the participants who have joined. And also, I welcome formally Dr. Balakrishna Shetty for our CeRIMed talk today. We are very fortunate to have him here today. And briefly, the CeRIMed is a unique platform which we started about a little over a year back. It stands for Center for Research in Integrated Medicines. This is a new way of looking at our wellness because, as you all know, all our regular treatment, whatever we do with allopathy or any other pathy, has limitations. And we are trying to find integration and find the evidence for those and how it helps, where it doesn't help. Fortunately, we started a similar program which is going on very well called IWSP, Integrated Wellness Science and Practice. And in that, we have our eminent doctors, and where two of the doctors, one is Dr. Sushil Sharma and Dr. Shami Dadipanandaji. They help to demystify the current science of medications and also brings the ancient wisdom of meditation, yoga, and pranayama. So with this, we have a very, very unique combination, and these are all supported by, we have a unique remote healthcare health support system called REACH. So with this REACH healthcare, which is helping us to support and going on regularly for this kind of program, it has you can see on our screen the helpline numbers. Through that, actually, you can get consulted by our eminent doctors. We have a panel of doctors, whether you are in the big cities or remote part of India, we support all kind of ailments for your wellness. So with this big background, small background about us, something very unique, we are very happy to present a very special talk by Dr. Balakrishna Shetty. He's going to talk to us on evidence-based medicine for wellness. And it's a very, very prolific speaker. I am very fortunate to introduce his briefly about his background. He is currently the Vice Chancellor of Sri Siddhartha University, located in Tumkur, just outskirts of Karnataka. And he's one of the youngest Vice Chancellor and who is has the unique distinction of being a not only educator, but he has an MBBS plus he has done his MD on radio diagnosis from prestigious Kasturba Medical College, Manipal. It's more than he's a regular practitioner on, especially on pediatric radiology, and he has traveled well, and he talked in many of those popular forums. His talk is really popular even in TV and Doordarshan. So when he talks about wellness, science of it, even which connects the spirituality, hopefully we'll hear some of those and see the evidence how it happens. He's not only talking, but he is practicing with many of those international hospitals. So some of those popular universities like Yale University, Texas Children's Hospital, popular, very famous MD Anderson Cancer Hospital, even I can see the Cleveland Clinic, US. So we are very fortunate to have a speaker of this quality and the depth who understands from his own experience. At the same time, he sees a new way of handling wellness based on the evidence. So with this brief background, I'll request now Swamiji to tell a few words about the speaker and how we connect to him. Swamiji, please.
Namaste. A warm welcome to all our esteemed participants for this CeRIMed talk. Yes, we have a very special guest as our speaker, Dr. Balakrishna Shetty. Is a very good teacher in the field of radiology. He has large number of students all over India and outside India who follow him even after they pass out their MD radiology. He is known for his talks at the national and international seminars, and I know him personally when I happened to visit his institute in Tumkur. So we had a night interaction and we started working together. He has volunteered himself to serve at our Ramakrishna Mission Trivandrum, where we have a 200-bed hospital. So he helps to run our radio diagnosis center there. Especially, he was the one who helped us to establish the new MRI center there 2 years back. So we were together in Trivandrum, then we traveled to Kanyakumari. Yes, he also practices wellness. He believes in wellness, the lifestyle modification that one has to practice to lead a happy and healthy life. So a very prolific speaker and a person who practices wellness. So very nice devotee of Ramakrishna Mission too. He had been to Haridwar. We spent some time together in our hospital here. We went to different places in Haridwar. So this is how we are connected, and we keep on discussing things when it comes to wellness and other activities. So with this brief introduction, now I request Dr. Balakrishna Shetty to talk on the topic evidence-based medicine for wellness. So let us listen to Dr. Balakrishna Shetty. Namaste.
Thank you, Swamiji. Pranams, Swamiji. Pranams, Subrata Chattopadhyay. Thank you for that brief introduction. And it is my privilege to speak about evidence-based wellness or evidence-based happiness for that matter. I thought as a radiologist, I should speak because I heard a lot about CeRIMed. I wanted to get involved with so many programs of Swamiji. And when Swamiji started CeRIMed and we got involved in this CeRIMed, I was waiting for this opportunity to give my lecture. So I feel I am very proud and I am really blessed to talk on this CeRIMed platform. With these few words, let's go ahead with our presentation, which will be very, very important. I feel I would like everybody to go through these each slide. Basically, we would like to know evidence-based medicine, how it is useful for health, how it is useful for wellness, and how it is used for happiness. So these are things which we'll be talking, that is health, wellness, and happiness. So with these few words, let me share my slides here. So evidence-based wellness, like, because we know death is accidental, but and birth is accidental, but death is inevitable. But we are all worried about causes of aging, disease, and death. So what is evidence for all these problems? Long back, maybe in 17th century, maybe in 7th century, I would like to say, Siddhartha's father, Shuddhodana Maharaja, wanted to keep the evidence of aging, disease, and death away from his son Siddhartha, because somebody told him, if he comes to know about all these problems in life, he'll become a great saint. So Shuddhodana wanted to have his son along with him, the only one son. But the moment Buddha saw this aging, he saw the disease, he saw the dead body, Buddha became a saint and he became a great scholar. So that is evidence. That is how evidence will bring about a change. That is one big example. I would like to say how evidence makes all the changes. So as a radiologist now, I'd like to say evidence-based medicine. Of course, from time immemorial, we have been thinking about what is the cause for the evidence-based, what is the cause for the disease. We said it is due to some agent, that is a host, and that is environment. We say agent. Let's say if you talk about coronavirus, it's the agent is a virus. Host, we talk about a lot of parameters of the host. We say comorbidities will kill the host. And environment, that means the get together, the meeting, seeing contact with the infected person. So it is an interaction between agent, host, and environment which causes the disease. So when we talked about evidence-based medicine, and our scientists, our intellectuals told us that it is an interaction, disease is an interaction between the agent, host, environment, and the manifestations of disease. When you talk about disease, of course, what is the evidence? We can see so many things. Like, let us say, if it is a visually, if I see a patient, I can see the wrinkles in his face or some small keloids or neurofibromatosis. All these things I'll be seeing. But the question here is, what if, how to see the internal parts of the human body? Is it enough only to see the outside? We would like to see the inside. We would like to see how is his brain, how is his heart, how is his lungs, how is his liver. All these things may be important. So this brings us to the discussion on evidence-based medicine. We would like to see the internal parts of the human body. Why it is important, I'll tell you. This is about 32-year-old man who had a swelling in his right cheek. The surgeon said, okay, there is a big swelling, I would like to operate. And he operated on this particular cheek lesion, but when he went inside and he did the surgery, he felt that he will not be able to remove that tumor completely because the tumor was going deep inside. So we would like to do a imaging, and the patient came back with a big scar on his near the neck, and it came for a CT scan. When we did a CT scan in this particular patient, we can see that the tumor on the right side is going. You can see that this is a tumor. You can see on the right side, this tumor is not only on the superficial tumor, it is going almost extending deep up to the blood vessels, which are very important for the circulation of the brain. So the surgeon could not handle this because he did know up to where it is going. At the CT scan, this is a CT scan of the neck, which shows the entire extent of the disease. And also it will show, this is what is called the fat. I'll talk about this fat a little later. This black one is a fat. So it also says there is a tumor which is going inside, and it is going up to the what is called the carotid vessels, which supply the brain. But you can see the fat which is separating this tumor from the blood vessel. That means you can resect this without damaging the blood vessels. So this is a deeper extensions. This is one of the evidence-based medicine which helps us to tackle this particular tumor. Now another patient, this patient about 45-year-old man, he came with a chest X-ray. There was a lung tumor, there is a big tumor, and it was diagnosed as a bronchogenic carcinoma or a lung cancer. So that surgeon did a great heroic surgery, and this particular tumor was removed. Within a few days, the patient came with the seizures or with the convulsions, and we did a CT scan. We did the MRI of the brain, which showed that particular disease has spread to the entire body, including the brain. It is called as MRI, showed brain metastasis. What I'm telling is, if there is a lesion here, if there is a tumor in the body, it may not be just a local tumor. It would have spread all over the body. We would like to know, before removing this tumor, we would like to know where all it has spread. So this is the most important. This is the important factor of evidence-based medicine. Now, evidence-based medicine, is it important? Because let us say now patient comes with blood in the urine. We will do MRI. We will do the MRI of the kidneys, and the blood in the urine could be from the kidneys, could be from the small tubes which are called the ureter, could be from this particular organ called the bladder. It could be from anywhere. We would like to know from where the blood is coming. But only thing is, when the patient passes urine, he will see blood. But we would like to know from where it is coming blood, where the blood is coming. Is it coming from the kidneys? Is it coming from the ureters or the tubes? Or is it coming from the bladder? Or is it coming from the outside external genitalia? So we would like to see the internal parts of the human body. That's what evidence will show us. That is called evidence-based medicine. So what I would like to say today, it is not open and see, it is see and open. Those days when a patient comes with the pain in the abdomen, we will press the right side of the abdomen near the appendix, and the patient has got a lot of pain. If he screams with the pain, we'll say, oh, this is appendicitis. go and shift him to the operation theater for the surgery. And on operation theater, you may or may not find the inflamed appendix. So it is not opening the abdomen and seeing the abdomen. Before opening the human body, we want to know what is the problem in the human body. This is called as not open and see the abdomen, see and open the abdomen. So we have got various image guided procedures. We can do that by an X-ray, by an ultrasound, by a CT scan, by an MRI, by a nuclear medicine, by PET scan, SPECT scan. There are so many plethora or so many spectrum of medical investigation or medical imaging modalities through which we can image the entire abdomen. You can cut the abdomen into multiple sections, 1 millimeter sections, 5 millimeter sections, 10 millimeter sections. We can cut the human body into multiple sections and we can visualize what is happening. Now this is the simple thing is the X-ray here, which is where it is all black and white image. You can see the heart, you can see the lungs, you can see the bones, or you can see the intestinal parts by giving some contrast, which is called the barium enema or the barium swallow. We ask the patient to drink some barium and we'll take X-ray pictures. Apart from the X-rays, we can do CT scan. CT scan is nothing but taking multiple sections and you can see how the body can be cut into multiple sections and see what's happening inside the human body before doing the specific surgeries or specific medicine. This is a CT scan, picture of the CT scan, not important. Now let's say, now if a patient has got let's say patient has got a fall, this is a CT scan of the brain. If the patient has got a head injury, you see something, the white thing is a blood inside the brain. You can see this is the middle picture is a normal brain, and inside the white one is a bone. Inside that, the gray one is the brain and the black one is the fluid. So anything white inside is due to blood. Now, of course, when you see the blood inside, that means there is hemorrhage. So this is one type of hemorrhage. This is another type of hemorrhage. So it is number one, when you do a CT scan, we'll identify whether the patient has got a road traffic accident. We will see whether there is a bleeding or not. So you may say only some bleeding outside the skull bone, or you may see bleeding inside the skull bone, what is called the blood inside the brain. But there are many types of blood inside the brain. The blood can be entirely inside the brain, or it can be outside the brain. It is outside the brain. For example, now in this particular patient, the first case, the blood is outside the brain, which is called as extracerebral hemorrhage. This is a medical emergency that immediately that they have to do a burr hole here and remove this blood. Now they see blood inside the brain. It is not a medical emergency. So by our knowledge and experience, we know that these particular sectioning images will tell us whether there is hemorrhage. Basically, it happens with the children. A small boy, small child fall from the cot and having some symptoms. We don't know the symptoms. May be due to hemorrhage, may not be due to hemorrhage. But when you do a CT scan, we will say whether there is bleeding inside or not, number one. Number two, whether this bleeding, something has to be done or not. That is the two things very, very important. So this is the beauty of evidence-based medicine. Now let's say, now this patient, about an elderly patient, comes with a stroke. Now if a stroke means, of course, there is some problem in the brain. The patient in the stroke, that one possibility is there is no blood flowing into the brain, which is called paralysis. That means there is a blockage of blood flowing into the brain. The blood is not flowing. So that will be seen as a black. The same patient, if there is bleeding inside the brain, also he'll come with a stroke. So stroke, for clinically, when you evaluate the patient, when a patient comes to you, he comes with the features of one-side paralysis or some evidences of stroke, which could be due to reduced blood flow or increased blood flow and bleeding. So this patient needs a medicine to increase the blood flow, whereas this patient needs medicine to stop the blood flow. So evidence-based medicine will tell us what is required, what is a diagnosis, what is a further management. So diagnosis will help us in management, and the patient will get a better care by proper diagnosis. And look at this particular patient. These patients have got multiple tumors. So, okay, this is a brain patient. Now you see these particular two things in the brain. This is called calcifications, which we don't do anything. Now you see one more brain lesion here. This could be due to infection, and you see the large one, it could be due to tumor. So all three patients have got some problem in the brain. By assessing the brain properly, I'll tell you this is calcification. If there is a calcified lesion, it is touch me not, don't touch me, don't do anything. Simply you have to see, you have to ignore that. Now if it is an abscess, then you need to do some treatment, some medicines. Or if this is a tumor, it has to be removed. So the basic knowledge of medicine will tell us three things, which is very, very important. One is it a good lesion? Is it a good problem, which you need not do anything? I say it is something which is good, something which you can, ignore. Good. A bad lesion, it is a bad lesion. I need to do something, I need to give some medicine, or an ugly lesion. So basically, evidence-based medicine is not giving the entire histopathology or cause of the problem. Is it a good lesion, bad lesion, or ugly lesion? So that is what I would like to say to the patient. Look, you have to go home, no worry, good, bad, ugly, that is a decision I need to make. Now coming to, again, the most important problem we had, that is a corona infection. You can see the corona infection. For the COVID infection, we used to do a lot of RT-PCR tests. We used to do the test, but the tests had got only 50% sensitivity or accuracy because of the various problems in getting the material. So these patients with the particular disease, they had symptoms like they had fever. The first symptom was fever. That is the evidence. We have got evidence that this is a COVID patient. He has got a fever. Now, with the fever, increasing fever, the virus will attack the lungs. It will go to the lungs, and when the lungs get attacked, then you get the oxygen, and the oxygen saturation will decrease. So then he'll come with the oxygen. So since with the decreased oxygen, he'll be more and more symptomatic. So that time we need to give a medicine. Now let us say the first phase, when the virus has attacked a patient, he has got a fever, but remember, we don't have any specific antiviral disease. He needs a proper conservative rest and other things which are very, very important. And when the disease spreads to the lungs, it is an inflammatory process. It is not the viral process. It is an inflammation that has to be treated by anti-inflammatory drugs. And most of the times, the drug which has saved many lives is a steroid, because the steroid saved the lives. It is an anti-inflammatory, very strong anti-inflammatory drug. And in the last case here, it is all linear. They are all fibrotic changes. That is a post-viral. So in a COVID infection, the CT scan of the chest will give you very, very important information. And now when all the patients have got all the more than 1 crore vaccination is done, I feel infection may come in, people may get infected just like a common flu, just like influenza. Nobody should worry about this particular influenza. I don't think testing is very, very important, and I don't think it will create a lot of problem. And only when these disease spreads into the lungs, it will cause depletion of oxygen, and then the patient has to do something. And remember, this is to avoid this further manifestation of the COVID infection. I feel everybody should do that pranayama, the lung exercise. Basically, I would like to, Swamiji has showed me that lion pose. I would like to demonstrate one that is very, very important. Like it, take a deep breath. Classically called as lion pose. In that, very important is to take a deep breath and you put out the breath completely, and also you should make a sound, like we said, the sound, like the sound is like a, blowing your conch, like Panchajanya conch or something like that. You are blowing a conch, something like that, so that your virus should get afraid of your conch and should run away from your body. So what I'm telling is, when you do that particular exercise, for example, I'll show you again, the corona infection is a fight between the virus and the human bodies. Everything, all infections, all diseases are fight between the human body, the agent and the host. I showed you already. The diseases are manifestations of the fight between the agent and the host. If the agent wins, you will get a disease. If the host wins, you will survive the disease. You will defeat that disease. So if you have to fight this particular disease, you have to increase the vital capacity. When I breathe now, as I'm sitting here, as I'm breathing, the amount of oxygen or the amount of air going inside my human body, inside the lungs, is only 500 ml, half liter. When I take a deep breath, 2,500 ml, 2.5 liters of air will go inside. It not only that 2.5 liters of air is going inside, it increases the capacity. As the capacity of the lung increases, the lungs will get more time to fight the coronavirus. Any virus attacked in the lungs, because the lung has got a more capacity, you increase the vital capacity of the lungs. So because once the virus attacks the lungs, if 50% of the lung is invaded, you may gradually succumb to the disease. If the 50% lung is invaded, but your vital capacity is almost 100%, it is only 50% of the involvement of the lungs, but your lung capacity is more, the lungs will be still fighting with the coronavirus. We will not succumb to any disease. Remember, there is no specific antiviral drug. The only one thing is vaccination, vaccination, vaccination. And the second thing is increasing your immunity and increasing in vital capacity through pranayama, and especially the lion pose. Okay, this is what it is. Now, this is again, I'll show you this is a MRI of the brain, MRI of the spine, which shows the causes of the back pain. You can see the bones, you can see the discs in between, and you see the nerves in between. If the discs herniate behind, they'll press on the nerves and they will cause the back pain. So that is the cause of back pain here. So again, you can see the intestines by MR imaging. These are all I'm showing you evidence-based medicine. You can see the intestines here, normal intestine. We can see the intestine which has the tuberculosis of the intestine, which has affected the lower intestine. So you can see the normal intestine as well as the abnormal intestine. So this patient, this is about a 12-year-old pregnant lady who came to us with a bleeding. We do an ultrasound, and in the ultrasound you can see that the gestational sac, the pregnancy sac is there, but you don't see the fetus. But in other case, in normal case, you can see the fetus inside. So both patients will come with the bleeding. They'll come with bleeding and they're apprehensive whether the baby is there or not. In first patient, there is no baby at all. So this has to be evacuated because the baby has not formed. The placenta, the gestational sac, all things formed, but the baby has not formed. Here, the baby has formed. Again, you can do ultrasound, see whether the baby is viable or not. So this is the evidence-based medicine. If there's a twin pregnancy also, you can see that. So this is the evidence. Similarly, this MRI. This is a full body imaging. Now, for example, what is the beauty of full body imaging? Patient comes with a road traffic accident and is unconscious. Most of the times, these patients are taken to mental hospitals or the neuro hospital thinking that is a brain injury. But the injury may be somewhere else. It could be in the bones, it could be in the pelvis, it could be in the liver, it could be in the pancreas, it could be in the intestine. Whole body can be evaluated by CT scan within 5 minutes. All road traffic accident patient, without knowing what is the problem, where is the injury, you can do a proper study and you can send the patient to the dedicated hospital without simply moving around from brain hospital to the heart hospital to the lung hospital to the heart hospital. And this is a cardiovascular disease. You can see the three vessels, and you can see the vascular changes in coronary angiogram. Similarly, you can see the blood vessels of the whole body. These are all quickly I'm going through this. Now finally comes, there is a one tumor. When you see a tumor, it is very, very difficult to say that particular tumor. Tumor is a swelling. All swellings are not malignant. It could be a benign tumor or non-dangerous tumor, or a non-dangerous tumor or a dangerous tumor. So if you see a small tumor, which is not spreading everywhere, or you see a tumor. Here you see this tumor which is spreading everywhere. So this is a cancerous tumor. This is a non-cancerous tumor. So evidence, this is also a cancerous tumor. So the evidence will tell by looking at the tumor, you can say whether it is a cancerous or not. Sometimes when a small tumors are there, then it may be difficult. Then you have to see how much is the blood flow. Like this is a small benign tumor. In a malignant or a cancerous tumor, you will see increased vascularity, and we can record that by giving injections, and you can see how the blood is flowing to various tumors and identify whether it is a dangerous or a non-dangerous tumor. Full body imaging we can do and look for the spread of the tumor. And various brain, this is called the functional imaging of the brain. What is the functional imaging of the brain? When the brain functions, there are particular neurons of the human body. If you move your left hand, the particular neurons of the human body will start showing the activity. So the activity can be recorded by MR, what is called functional imaging. So these studies are done by magnetic resonance imaging. Now, most important thing I would like to say is if there is a brain tumor, let us say if there's a brain tumor, you can see there's a brain tumor and there are the nerve tracts which are going. So this is a nerve tract which controls the human body. If there's a tumor, if you want to remove the tumor, you should not remove these tracts because the patient has to survive and patient has to do his daily responsibilities and daily work. So you need to remove the tumor, but you should not remove these particular axons or particular fibers. So the image will tell you whether this particular tumor is infiltrating vital structures of the human body, like that. As you can see the human structures here. So, but I would like to tell you, these informations will tell you what are the position of the vital organs. But I remember one day I've seen in a child, we saw the Broca's area. Broca's area means the area which is responsible for speech. And we removed that speech, a neurosurgeon removed that speech area from the brain. But within 6 months, the speech area of the brain, it developed in the other part of the brain. So that is the most important find. So how the brain adapts to all these problems, how the human being is always responsible for survival. Survival is the ultimate aim of the living organisms. I'll talk to that a little later. So survival. So evidence-based interventions also you can do. Wherever there is a tumor, wherever there's an abscess, we can put a catheter and remove that. This is evidence-based. Now, evidence-based medicine for illness. What are the disadvantages? Let's go through some of the disadvantages now. Now, it is said that it is evidence-based means you have to assess the problem, ask the question, acquire the evidence, appraise the evidence, apply to the patient. So this is the evidence which we get. So evidence-based medicine could be through radiology or through the lab tests. But these are all these are some of the this is a pyramid of evidence. Like you can take an expert opinion about the disease, case series and case reports. You can study multiple cases and case reports, case control studies, cohort studies, randomized control trials, meta-analysis, clinical guidelines. So this is the evidence. This is the pyramid of evidence which we start getting for the hierarchy of evidence. This is a pyramid of evidence for doing a treatment for a particular disease. But these are the evidences could be from radiology or from laboratory evidences. Okay. But the most important by David Sackett says, evidence-based medicine is an integration of best research evidence with the clinical experience and patient values. These are two things important. It is not just the evidence, the integration of best research evidence with the clinical experience. What is my experience? I see a lesion. I told you the brain image. I told you there is no bleeding, but the patient has got symptoms. But I know there is no bleeding. That is my clinical experience. And the patient values. This is a most important statement, which I'll be talking for the next 20 minutes. So the integration of best research evidence, the integration of structural evidence with the clinical experience of the doctor. That's why they say most experienced patient is better than the new doctor. The clinical experience and patient values. Let's go with these for the next 5 minutes. Now, improved patient outcomes, you get an individual clinical expertise, patient values and expectations. That is also important here. Patients' expectations are important. I showed you one tumor where there is a tumor is almost going up to the neurons controlling the movement or the day-to-day work of the patient. So patient's expectation is that he may say, doctor, I'll keep that tumor, but I want to work. So the patient's expectations are very, very important when you manage the patient, and the best available clinical evidence. So best available clinical evidence, individual clinical expertise, but patient's values and expectations are much more important for improved patient outcomes. This is very, very important. Everybody should understand. Now, the clinical evidence, who has hijacked the clinical evidence? Just see the third sentence. Quality of the evidence for the first listed primary outcomes only 13% high. The clinical evidence The evidence, research evidence for a particular disease, only 13% high, 30% moderate, 31% low, and 20% is very, very low. The evidence-based medicine has got the highest relevance only for 13%. Even when all outcomes listed were considered, only 20% had at least one outcome with high quality evidence. Of the reviews with high quality evidence, only 25 had both significant results and a favorable interpretation of the intervention, Cleveland Clinic research. So the evidence-based medicine is only 20% right. Now, what decides rest of the things? Why? Why evidence-based medicine is getting hijacked? Publication bias. Negative results remain unpublished. Very important. Selective reporting bias. Negative results become positive. Biased reports. They don't show us the negative results. They show us only the positive results. And we do have a data for that. And the fake positive results. Three things are very, very important. So evidence, I showed you some images where there are structural changes for a particular disease. Now I'm coming to these research parameters where negative results remain unpublished, negative results become positive, and the fake positive results have hijacked the evidence-based medicine today. Let's talk about obesity. How obesity, the research in obesity has been hijacked. Evidence-based method, obesity is, they say, one of the causes, the most important for type 2 diabetes, hypertension, ischemic heart disease, dementia, Parkinsonism. You name any, they say obesity is an evidence-based medicine. Now look at this. Obesity is a cause for chronic diabetes, hypertension, heart disease, cancer. But who is causing obesity? We are causing obesity. Now what I'm telling here is obesity over a period, like this is a 2010, this is 2000 to 2010 study. Okay, we said obesity is 2.78%. Obesity is increasing by 2.78%, but diabetes has increased by 4.07%. So obesity is not the cause for the diabetes. Very simple. Obesity is a problem. Obesity is increasing worldwide by 2.78% per year. 75 to 2020 Lancet data. Diabetes is increasing worldwide by 4.07% a year. Now look at this. Now if you say, if in an obese person, let us say 80%, let's say there are 30% obese people, and 80% of the 30% people have got obesity, means we have got, out of 72 million obese people, we have got 57 million sick people. Now, out of the non-obese people, 160 million people, and only 40% are sick. Out of obese people, only 80% are sick. Let us say out of non-obese people, only 40% are sick, and it amounts to almost 67 million. So out of obese people, only 57 million people are sick. Out of non-obese people, 67 million are sick. So now it is what? It is not the obesity which causes all these diseases. Now it is called as metabolic syndrome, where all the money goes. Now let's say diabetes, hypertension, lipid abnormalities, cardiovascular disease, non-alcoholic fatty liver disease, polycystic ovarian disease, cancer, dementia, everything is associated with obesity, but there is no specific correlation between obesity and all these diseases. I'll show you this particular disease. Now, let us go there again, cross-sectional imaging. Hope all of you can see the first two images. Now look at the first two images. This particular patient is a white is fat and the black is muscle. Now look at this. This is a subcutaneous fat. This patient is termed as an obese patient, okay? And this patient has got white inside and also inside white also there. So this patient has got white fat inside, fat inside. No, now this is a new topic which is called, look at this. Now this patient has a trunk fat as 12.8%, okay? And he has got fat outside and less fat inside. This patient, again, trunk fat is 12.8%, but he has got a lot of fat inside. This is a new category of patients whom we call it as fat outside, lean inside. Now again, this is a fat outside and fat inside. Which is more important? We do not know. Let us say, I'll come to that again. So the fat which we see outside, which is called as obesity, it may not be obese at all because he may be having a fat inside. We'll come into the next picture here. Look at the histology of the liver here. Now, if I take a liver and I study the liver, this is a normal liver. This is what is called the fatty liver. Look at this. There's a lot of, if I cut the liver into multiple places and take it in a slide and see under microscope, this is a normal liver. This is abnormal liver. This is called fatty liver disease. Now, fatty liver disease, you can see a lot of fat inside the liver. Now, what is the correspondence? What is the correlation between fat outside, fat inside? Fat inside the liver. Liver is a factory of the human body. And if there is fat inside the human body, how it will manifest? Now look at this. Now, NAFLD or non-alcoholic fatty liver disease is a worldwide problem. Even in normal weight people, we have got fat inside the liver. Normal weight people have got a fatty liver. So fatty body outside, fatty body inside, fatty liver. These are three conditions. Whether evidence-based medicine can tell us how the patient will have disease of the liver, let us go to that. Now let us say, now this is the liver. Now this is how the fat can be seen in the liver by MRI. Now look at this. This is a very classical example which I took from internet here. Now this person is an obese person, low liver fat, 2.6%. This is a liver. This is what the black is a liver, low fat, 2.6%. He's obese. You can see outside, lot of fat. There's a fat here, there's a fat. Hope you can all see the pictures here. So the first picture I'm showing, there is a fat outside, but there is no fat inside the liver. Liver is healthy. Obese patient, low liver fat, 2.6%. This is obese patient and obese liver, fat inside liver, obese, high fat to 24%. This is a thin patient, no fat outside, but lot of fat inside. High liver fat, 23%. Now look at that. This is a thin, this is an obese patient with normal liver fat. This is an obese patient with again abnormal liver fat. This is a thin patient with abnormal liver fat. So obesity is a commercialized factor to discuss so many things about the diseases. I don't want to go into the details of all those because of the time constraints here. Now I usually put this picture. I would say elephant is not sick and deer is not the healthiest. Let us not try to make the elephant into a deer and deer into the elephant. So fat can be normal. Fat has got a lot of responsibility, a lot of duties to do. It is not the weight of the human body, which is something else which decides a human wellness. Let us go into the details of that. Now, bariatric surgery, we said, the fat, obesity is a cause for all diseases. We did extensive surgeries for so many people. Are they really happy? Are they well? Are they happy? Wellness is the wellness is done because of reducing the body fat? You should ask only those people to answer this question. So the imaging should be: is it a good fat? Is it good finding? Is it a bad finding? It is an ugly finding. That is very, very important. And the patient impact and what the patient needs, how you can help the patient, as B.M. Hegde says, you can rarely treat the disease, treat rarely, then what? Comfort mostly and console always. So that is the most important point. B.M. Hegde is my teacher. So I would like to pronouns for my teacher, Professor B.M. Hegde, and good, bad, ugly is the most important factor to be considered. Evidence-based medicine can inform us about the strengths and weaknesses of various study designs and the state of the evidence landscape. Quality of evidence is low in most biomedical fields. Most current evidence on nutrition at the population level is hopelessly biased and unreliable. Bias should be taken for granted. In the current environment, the literature is shaped primarily by the biases of the scientists, reviewers, editors, often the same people, and sponsors. So this is the most important. The sponsors, the sponsors who sponsors the drugs are providing this evidence-based literature in the present literature today. So major reform is needed and do have potential solutions. Okay. This is again how these how the food industry, how the food industry is causing diabetes and various diseases, and what is the relationship, what is the understanding between the food industry and the pharma industry and other things has to be seen in detail. I don't want to go into the details of that, but I'll discuss that a little bit again. So the total body composition of the fat is very, very important, how much fat is required, and the how fat will save you at the time of emergency when there is no nutrition. Let's go to the next slide. I'll talk about most about the fasting. Okay, so the most important thing, I said the food is the number one culprit of most of the diseases, basically because it is driven by the lot of food drug sponsoring industries. Now, what will happen in fasting? In fasting, basically, I am the most important proponent of fasting. It may be intermittent fasting or whatever it is. In fasting, there is increased glucose formation. In fasting, what happens? The glucose will reduce. The total glucose in the human body, in the blood, will reduce. So increased glucose formation, what's called gluconeogenesis. Decrease insulin, most important. When you fast, there is no glucose in the human body, in the blood, so that the amount of insulin comes down. It is said the amount of insulin the pancreas can secrete is almost finalized. They say dane dane mein likha hai khane wale ka naam. Similarly, the amount of insulin which is stored in pancreas is very much limited. Okay, you cannot keep on stimulating the pancreas with the sulfonyl ureas and various other drugs to secrete the insulin. So we need to suppress the insulin secretion from the pancreas, and the only one method to suppress the decrease the insulin secretion is fasting. So when you fast, there is no insulin, so the various stores from the human body will get liberated and converted into insulin, so that the body will survive, because the brain needs insulin. The brain needs glucose. Brain cannot survive with the glucose later. So your fat, the subcutaneous fat, intervisceral fat, all the fat will get dissolved into, converted into fatty acids, and then fatty acids will give the energy for the survival. So there is a decrease in insulin, increase in steroid, growth hormone, thyroxine, IGF. So the good hormones of the human body, the good hormones which are required in the human body, like steroids, thyroxine, growth hormone, this will be secreted more, because these are the hormones, and glucagon. These are the hormones which increase the glucose in the human body. That is the most important parameter here. So when you suppress the insulin, other good hormones in the human body will increase, because the body has to increase the glucose level in the circulation. Carbohydrate metabolism to it becomes fat metabolism. Minimize catabolism, depletion of carbohydrate precursors like glycogen. Glycogen will get released from the liver, depletion of body fat, and glucogenesis from amino acids and glycerol. And the most important thing of fasting is autophagy. The German scientist who told autophagy is the most important deciding factor for human health got a Nobel Prize for that. So what is autophagy? Autophagy is degrades cellular components to restore energy, homeostasis under limited nutrient conditions such as fasting and starvation. So when there is a decreased glucose, the cells of the human body will be searching for some energy components. They want some energy. They will be digesting all those half-baked cells, the dying cells, the viruses, and the unnecessary immune system cells for an autoimmune system. Now we talk about autoimmune diseases, and the autoimmune diseases are basically because of abundance of food. The moment there is deprivation of food, the body will try to eat up all those neglected cells, all those bad cells, all those half cancer cells, all those half bacteria, virus, everything will be digested by the human body. The human cells will keep searching for all these bad cells, and they digest that. So when you fast, the autophagy is the most important factor. Fasting promotes autophagy, anabolic hormones, example, insulin, IGF, and catabolic hormones like glucagon are significant regulators of autophagy, and this is a research article on autophagy. So, and what? Difficult to explain why healthy young man dies suddenly by massive heart attack. So this is the greatest statement by B.M. Hegde. Difficult to explain. Why? A healthy young man dies suddenly by massive heart attack despite doing everything correctly. Now, let's say how the human medicine can, whether human medicine or the medicinal literature or the evidence can explain all these things. It is difficult. And why an elderly man with advanced coronary artery disease jogs on beyond 80 years? Difficult to answer. Now, science and evidence basically works on mathematical or Newtonian principles, but life does everything for survival. Remember this, the basic aim of life is survival. And how life survives, let me explain in the next, maybe for the next 10 minutes. It is difficult to explain. A 300-gram heart can pump blood through 500,000 kilometers of small tubes. The heart, a small heart, can pump blood through 500,000 kilometers of small tubes called capillaries. And when this blood contains RBCs, which are got 7.2 microns, but the blood vessels are even less than 7 microns. So it is something like a heart which is pushing 7 micron, 7.2 micron RBCs through 7 micron size blood vessels. Just imagine the amount of the work the heart has to do. But the most important thing to be remembered is that heart is not pumping blood to any cells. These are the cells which extract blood from the heart. It is not the blood which is not the heart. So when you do more work, your muscles will extract the blood. Your liver, when the liver is working after food, the liver will extract more food. When you drink a lot of water, kidney will extract more food. When you do a lot of intellectual work, your brain will take a lot of blood. So it is not exactly the heart which is pumping, it are the cells. For example, I'll give this analogy of a plant, a big tree. How the water from the bottom of the earth will go to a tree which has got 40 feet, 100 feet height, to the tips of the leaves of the branches of the liver of the tree, the groundwater. How it goes? Is there a pump? There is no pump. The trees do not have the pump, but the water and the manures and the minerals, everything goes into the each and every corner of the leaves of the tree for photosynthesis. How it goes? That is called as a capillary action. So that capillary action, that is the same action. So that is why we say, if you have to do work, if you have to do the proper work, if your organ has to survive, your organ has to work. Only when the organ works. I had one patient, I quote this in each and every meeting. And one patient came, and with all the health checkup results, the liver result, liver bilirubin, direct bilirubin, indirect bilirubin, alkaline phosphatase. There are about 100. There are 101 tests for the liver. She kept that test report in front of me and asked me, "Doctor, my liver is working all right?" Immediately asked her, "Madam, are you working all right? If you work all right, your liver also will work all right." So this is a message I would like to carry. He had another patient who had come for MRI of the knee joint. I did MRI of the knee joint, and both the patient and the husband came to my room to discuss what is happening in the MRI. I said, "Madam, there is some wear and tear in your cartilage of the knee joint." Oh, she got so upset. "Madam, sir, doctor, what is this? I'm hardly 40 years old. How can I get so much of wear and tear? What is the cause?" My question was same thing. "Madam, you work?" Immediately her husband said, no, sir, she doesn't work." Then she goes to the gym. Then who does the household work? The household work is done by a maid. Oh, okay. So I asked that madam, "So madam, you paid some 8,000 rupees. How much you pay for the maid?" Maid, she said, "We pay about 5,000 rupees. Oh, madam, okay. You don't do your work. You don't do your day-to-day work. Your work is made by a housemaid. You pay her some 5,000 rupees. And today you paid me some 8,000 rupees for the scan. And tomorrow, if there is no work for your knee joint, the knee joint will have a wear and tear, and later you have to pay lakhs of rupees to put a new joint." So the God has created all the organs to work. The God has not created the shoulder to lift weight. The God has not given our legs to walk for marathon or whatever it is. It is not walkathon. It is not walkathon or marathon. What is important? I tell my student, workathon. Are you working or not? That is very important. When you work, each and every part of a human body will work. That is very, very important message to be carried. What I'm telling you, it is not the heart which is pumping. It is the each and every cell. And B.M. Hebde says very clearly, it is called membrane. There is a brain in each and every cell. It is not the main brain. Each and every cell has got a brain, so that cell extracts the blood from the heart. So the body, heart as a pump. Body, I gave you example of plants, body pumps and cellular pumps. Similarly, nervous connections, much more perplexing than the cardiac. Okay, I don't want, there are 200 billion neurons, 500 trillion connections, how these connections are made, who is responsible. But the scientific data, my friends in science and research will tell you how and what, they cannot tell why. It is difficult to explain why these functions are there. Okay, now this is a great example. I would like Pavlov's pouch. So, okay, the evidence-based medicine, he did the gastritis research. Okay, Pavlov, long back, he said he gave some food to the dog, and as the dog was eating, he collected the juice from the stomach of the dog. And every time he used to bell the ring. He used to ring the bell. Okay, and one time he just rang the bell, and he could see that there is acid secretion from the dog's stomach. So he said it is a conditioned reflex. That means he said it is not the food which stimulates the secretion of the gastric acid or hydrochloric acid. It is the message from the brain which is responsible for secretion of the hydrochloric acid. And come on, with these research, extensive surgeries were done to cut all the nerves which are supplying the stomach. There was a nerve which is called the vagus nerve, which used to come and stimulate the gastric secretion from the stomach. And I remember from 1980, I joined my medical school. From 1950, from almost up to 2000, almost for 50 years, surgeons did a great surgery of cutting these nerves. And when you cut these nerves, and this stomach could not pump, and they had to connect the small intestine here so that the food also will go out. This is called GJ vagotomy and gastrojejunostomy. And if you do that surgery today, it is a criminal work. It will be a criminal job by the end. It will be put behind the bars. So that was refuted by one more theory, which is called the germ theory. Later, we came to know that this particular disease is caused by Helicobacter pylori. This is a bacteria within the gastric mucosa, which was eating up the mucosa and causing ulcers. It is not the nerve which is causing the ulcer. It is not the nerve and not the stimulation of the nerve which is causing the ulcer. Helicobacter pylori was the germ which was responsible. And this particular aspect gave rise to the most important theory of human wellness, that is a germ theory. And similarly, it is not the fat. In the heart attack, it is not the fat which goes inside the blood vessels. It is the inflammation. It is the reaction which takes place in the surface of the blood vessels, which blocks the blood vessels. It is not the fat which we eat, not the cholesterol which we eat, and that blocks. The cholesterol hypothesis made billions of dollars of money for statin producing pharma companies. So it is not the atherosclerosis, it is the inflammation. Now, what is this inflammation? Let me talk to you for the next 5 minutes. Inflammation, not atherosclerosis, is responsible for coronary artery blocks. And coming to the germ hypothesis, health. Is it good? Is it good food, water, air, mind, exercise, fitness? For a long time, I remember from 1980, I joined my medical school with BMAD as my professor. I know we thought good food, good water, good air, good mind, thought for health. And later they said, no, this is not even enough. You should have to do exercise. Then people started doing exercise. They're doing bicycle, marathon, everything. They started doing exercise. Then they said it should be fitness. You know what is fitness? If you are lifting weights in the gym, you are fit for lifting weights. If you are doing a marathon, you are fit for marathon. If you are cycling, you are fit for cycling. You are not fit for your absolute well-being. That is very important. So what is important for well-being? That is 130 trillion cells, 40 trillion foreign cells. Let me not talk about sweating. What is important for human health is a sweat. It is not how many balls of protein you eat, how much of carbohydrates you eat, how much of fat you eat, how much of B complex you eat, how much of minerals you eat, how many drops of vitamin U apply on your face. It is how many drops of sweat comes out of your forehead. That is very, very important. You can sweat in many ways. I tell them there are 3 types of sweating. One is sweating by doing your own work. When you do your own job, that is a number 1 sweating. That's the most important. At least 2 drops of sweat per day from your forehead. Doing your own work, that is the best sweat. Otherwise, you can do sweating by doing your walking, jogging. Of course, that is also, I'm not against walking and jogging. So you can do that. That is the second type of that. And if you don't do that sweating, then the third sweating, you are forced to do that, to get that sweating. That will be by fever. You are prone for fever. And you will be admitted, one will be admitted in the hospital and having a lot of fever and sweating. So the fever, the sweat due to fever and temperature is basically because you are not sweating because of your routine day-to-day work. You avoid your work. Just I told you about that housemaid and I told you about that lady who was not doing her work and doing some other work. When you do not do your work, when you don't do sweat, we don't sweat. So sweating is very important. I tell my students, they say hane barha, that means something is written in your forehead. So whatever is written in forehead, you wipe out of that forehead what is written in the forehead. I'm sweating. That is very, very important. 5 more minutes. 5 more minutes, can I take?
Yeah, please go ahead.
Okay.
No problem.
So doing one's duty, whether our organs are working all right, and that is, I told you about human and osteopathy. Now, the third theory is theory of survival. That is the last theory. So germ theory, fasting, germ theory, now survival theory. Now let us say RNA, ribonucleic acid, coronavirus. Now what is coronavirus? I don't think coronavirus wants to kill anybody here. I have seen a lot of corona infection in 2 hospitals. I have not seen a single beggar dying of coronavirus. I have not seen coronavirus, and we have seen the example of Dharavi slum. There are so many slums without social distancing, without mask, without a sanitizer. The death rate is so less. So I will tell you, this is basically a factor of survival. There is RNA, ribonucleic acid, which will go somewhere. And if your immunity, if your body is not good, I don't think coronavirus has got any vengeance on human community or mankind. So you die because your survival, you are not good enough for survival. RNA is a cause for all human beings, all addition and all adaptations are because of survival. So this is a virus, which is a mutated virus within a human body. So within a nucleotide, within a shell. So all these things are viral particles. Let us go a little bit. Strong evidence, COVID-19 predominantly spreads through air. So it basically spreads through air. Now, body structure, diseases, where is our enemy? Most of the diseases are endogenous, interaction between good cells and bad cells. Okay, so it is the interaction between the normal human cells and abnormal cells. 130 trillion cells, 50% are abnormal cells. It is a fight between the common cells and the fat cells. Now, metabolism, I told you, histopathology. I'll show you this picture. Almost all 3 pictures, histopathology, cellular picture of 3 look same. I'll tell you, this is of mice, this is of dog, this is of human being. The liver is the same. If you give a cut section of the liver, I will not be able to say which is mice, which is dog, which is human. But see the difference. And similarly, the complex metabolism of human body is also very complex. But what is different? The human brain. Look at the human brain. So look at the human brain, the elephant brain, the biggest, the dolphin brain, the small brains. So what makes a human life? That the seat of human wellness is the human brain. So human brain, as I told you, as per the nature, as per the creator, it is the survival. It is a human brain always works for survival, and the survival of the fitness is very, very important. So happiness is a defense mechanism. I would like to say here, human brain is for survival, and whenever you feel that survival is not good enough, you think of happiness, you go with the pursuit of happiness. That happiness may be in the form of making a lot of money, the happiness may be in achieving something, and happiness may be in dissociating from everybody, becoming a saint and sacrificing everything. But happiness is a defense mechanism for the survival of any living organism. Okay. And it is driven by the chemicals. So this happiness is driven by 3 chemicals. That is the last point I would like to carry today. One is happy brain chemicals: dopamine, serotonin, endorphin, oxytocin. It is not the insulin, it is not the steroids, it is not the thyroxine. The happiness comes from 3 secretions in the human brain. I told you that happiness, the wellness is in the human brain, and the human brain secretes all these proteins like dopamine. Dopamine, when do you get dopamine? When the brain secretes dopamine, dopa, when you achieve something. When you achieve something, dopamine is secreted, you become very happy. Serotonin, when you help somebody serve, serotonin means serve. When you serve anybody, your body secretes serotonin, you become happy. Endorphin, when you show a lot of enjoyment in your work, you secrete endorphin. And oxytocin is a love and affection. So this is the dopamine, serotonin, endorphins, oxytocin theory is very, very important. I think from next, within 4 or 5 years, you will talk about only these hormones, nothing else. And they are on and off. These signals, these messengers are secreted on and off. You need to, it may down, it may be up. We need to go up the ladder so that dopamine, serotonin, oxytocin, all these hormones keep secreting in the human body. In summary, dharmo rakshati rakshitaha. That means if you do your duty, you will be always protected. Dharmo means that is my responsibility. If I'm talking today, that is my responsibility to talk properly. And if I'm Vice Chancellor, working as a Vice Chancellor, so your dharma, it is not the religion. Your duty is your dharma. Aptopasevi bhavit arogyan. Anybody who helps others becomes happy. And Isha Vasyam Hidam Sarvam Tena Tektela Bhujita. Nothing belongs to me, everything belongs to Isha. These are 3 things I would like to say. So gods and demons, the final thing is here. The gods and demons. So the gods and demons thought there is a lot of good things in the ocean. So they wanted to curdle the ocean. So they started curdling the ocean. And they got a lot of good things. And the demons told, we want to have those amrit or whatever it is. They wanted to eat that amrit. They wanted to eat the amrit. And Shriman Narayana, God came and told, okay, you can eat the amrit provided you should not bend your hand. Without bending the elbow or without bending the elbow, you should eat. And all these demons came and started trying to eat that Sanjeevini amrit. They could not eat. It was difficult to eat without bending the elbow. And then the next chance came to the gods. What the gods did, they sat each other. They sat opposite to each other. Okay, and one god fed the other fellow like this. You feed others and the other fellow fed the other. So what I'm telling you, it is give and take. So when you give, you take. That is a Wharton policy. Wharton University says the success depends on how much you give, not how much you take. So WHO physical says physical, mental, social, and spiritual well-being, not merely the absence of disease. That is a definition of WHO health. But what we say, one who gets up in the morning, ready to go for work is healthy. He may be having diabetes, he may be having hypertension, he may be having atherosclerosis, he may be having cancer. But if he gets up in the morning and he goes for the work, he is a healthy person. And who is a happy person? The person who enjoys his work is happy. Survival is the aim of all organisms. Human beings are the supreme because of the brain. Happiness is a defense for survival. Happiness is driven by 4 hormones. That is dopamine, achievements, oxytocin, love, emotion, and respect. E for endorphin, enjoying one's work. S for serotonin. That basically means does. Does means you have to do. As Swami Vivekananda told, do your job. We need people to work. We don't want people to sit and meditate. We want people to work. So that is Vivekananda's message. Do your work. anger, revenge, thinking ill of others, reduces happiness and survival mechanisms of the cells. Positive thinking, response, respecting others enhances cellular defense. Thank you very much for your patient hearing. Thank you very much.
Thank you. Thank you, Dr. Balakrishna Shetty, for a complex subject, but with a limited time, you covered so many dimensions of it. So I have many curiosity to ask, but before that, I just wanted to also find out about your one aspect, which is on the evidence side, actually, what you said, everybody aware of the evidence and don't know the meaning of the evidence, what is deals with it. Like evidence, what you saw about the CT scan, radiology, since that's your expertise, what you know that doing too much of radiology to your body also is a harmful. So do you have any comment, but doing those kind of radiology for all your sections and find out your illness? What is your comment on that?
Radiology, yes. Out of all these imaging modalities, only X-ray based investigations like X-rays and CT scans have got ionic radiation. So ionic radiation has got some effect. The radiation, the ionic radiation, or these radiations are there starting from the TV, mobile, atmospheric radiation. Everywhere there is radiation. But this radiation is little more in these X-rays and CT scans. Doing one X-ray or even 100 X-rays is not a problem at all. And we say the harmful dose of radiation is a cumulative dose for 1 year. So we don't say one X-ray will cause a harm. The cumulative dose of X-ray over a period of 1 year will, and there's a particular dimension for that, may cause harm. But basically, I would like to say one X-ray, up to 100 X-rays in a year will not cause any problem.
Okay.
And MRI, ultrasound, they don't have any radiation. Ultrasound can be done for pregnant women, the newborn babies. MRI can be done for pregnant women, newborn babies.
Yes. There is one question on the chat box. I'll also take that up. Before all these technologies of new evidence came about, like a CT scan, how the medical science is to manage this kind of requirement?
Basically on clinical evidence, like you see a patient, you find out what's the problem. And on clinical evidence, I told you if there is a abdominal pain, they used to operate and they will see inside. And if there's an appendix, they'll say they'll remove the appendix. If nothing is there, they'll used to close and come. Most of the times it was follow-up, I would like to say. Let us say, I told you the good, bad, ugly. Initially, it was like that. I think the patient has got a problem. Let's wait and watch. That's a good thing. Okay, this patient has got some problem. It's a bad thing. Let me give some medicines and watch. This patient, and the ugly thing is, okay, this patient has got something really bad. Let me operate and remove it. So that was going in the earlier days without evidence, good, bad, ugly.
Okay. This on the different topic, what you covered is very important, is fasting. There's a question also on fasting. How often one should do fasting in a month?
Fasting, the most important fasting, which as far as my knowledge goes, is intermittent fasting. Generally at night, let's say if you eat at 8 o'clock and get breakfast at 8 o'clock, it is a 12 hours fasting. Okay, I think that is the best, that is a usual fasting. But the extended fasting is minimum 18 hours of fasting. That means minimum 18 hours fasting is called as intermittent fasting. That means you skip your night meal. That is an intermittent fasting. That is very, very good. I just follow it once a week. Now, most of them are following almost every week. Like we eat 21 meals in a week. Let us say 3 meals a day, 7 days a week, 21 meals. What I suggest is skip one meal at least at night and regularly skip that meal every day. Let's say if it is Monday, Tuesday, Wednesday. So every week, Monday, you skip one meal. That is intermittent fasting. And some people follow that almost every day.
Yes. On the similar line, there is a question. Do you recommend children also to fast?
Absolutely. There is no contraindication for children to fast also. At least in my house, everybody is fasting weekly once. So the children, actually, we should promote children to fast. That is always better because All the junk food, I told you the evidence-based medicine about junk food, if it has to be neutralized, just please give one gap, one rest for the gastrointestinal system to eradicate or neutralize or clean up whatever junk food, because you cannot avoid junk food. You cannot avoid the pesticides, insecticides, everything, whatever is available in the food, water, you cannot avoid. But one fasting, your body systems will clean up all those things.
On this fasting side, there's one more question. Can diabetic patient also fast?
The diabetic fasting, the patients with diabetes fasting, it should be under supervision. Okay.
Yes.
Now, borderline fasting, borderline diabetics should 100% fast. I think they will be cured of diabetes, borderline. Now, those who are insulin dependent diabetics, then it's a difficult question to answer. They need to be under supervision, because I don't know what is their metabolic status, and by fasting whether something will happen to them. So, but borderline definitely should do fasting, and I think that will be a cure for fasting.
Something on a different topic. This is on sweating. What is the direct relationship between sweating and health? Is it because it leads to workout or something else?
Sweating, exactly, if you go through the physiology of sweating, sweating is a mechanism to maintain the body temperature, number one. And the second is to eliminate extra water. So these are two basic mechanisms if you read about the physiology of sweating. But what sweating, I want to say that the sweating which occurs when you do your day-to-day work. One day one student asked me, sir, sweating, what should I do, sir? Sweating. I said, what time you get up? Have you made your bed properly? Have you washed your clothes? Have you washed your plates? So the day-to-day work which you want to do, you should do. And that is very, very important part of sweating.
So now there is a question which is much more fundamental in nature. It's about what are the evolution of next steps in complete avoidance of invasive evidence possibilities?
Evidence of? Repeat that question, sir.
Next step of this evolution is the avoidance of invasive evidence possibilities. That means you don't need to do invasive evidence.
Oh, most of the times we do all those images which I showed you. These are all non-invasive evidences like CT scan, MRI. All those are non-invasive. Only angiograms which you do for the coronary arteries, they are invasive. You have to push the catheter. But we can do coronary angiograms without invasive also. Invasive means basically we can give a contrast injection to the veins, the superficial veins. We can give injection. That is also considered as a non-invasive, because you are just puncturing the vein and pushing some contrast, and you can see. So right now we do not have options. We do not have many invasive imaging. Most of them are, I would like to say, 99% are non-invasive imaging. And once you do the imaging, then we do the invasive procedures. So all these imaging are non-invasive. For treatment, we do invasive procedures. Like, for example, there is a block in the coronary artery. We cannot do anything by imaging. You can definitely do by putting a catheter and opening up what's called as angioplasty, stenting, and all those things we can do.
Right. So there's some questions on fatty liver. Will proper diet and sweating exercise will help to get rid of the fatty liver?
Non-alcoholic fatty liver disease is a major problem, number one. And I do not have a lot of evidence-based medicine for that. But definitely, I told you, when the patient fasts, there will be liberation of fat from various parts of the body, because the body needs energy. When there is no glucose, when there is no carbohydrate, when there is no glucose, the fat depositions from the various parts of the body has to be mobilized. So I feel fasting may be one of the important factors for reducing even the liver fat. But I don't have real evidence, but I think it will be definitely useful.
Yes, also there is a question on gout. Sir, can gout patient also can fast?
Gout patients definitely can fast. So only fasting contraindication is mainly metabolic syndrome, not the only those with the diabetes. Okay, fasting means deprivation of glucose. Fasting means deprivation of glucose. 15 hours fasting should not cause, 18 hours intermittent fasting should not cause any problem, even in diabetes. I have tried these things in my patients with the severe diabetes also, but I do not recommend because I do not know what will happen. I'm not sure. But fasting is very, very useful for many diseases, starting from diabetes to cancer to autoimmune diseases to gout, uric aciduria, then thyroid conditions, all these conditions, that is why in Ramzan there is fasting, in Ekadashi there is fasting, and the animals regularly fast. The animals eating when you are not hungry, eating food without hunger is a poison. That food is a poison. I'll tell you, I would like to tell that is a poison. When you are not hungry, one should not eat. So the animals do not eat if they are not hungry. No, animals will not eat if they are not hungry. So that is very, very important. That is why I recommend fasting here.
Yeah, you talk about the animal world. I know a beautiful case of snake. In the winter time when they hibernate, they don't
Yes.
eat for months.
Yes.
And that's how the skin peels off and they become relieved. Again, they become fresh.
Correct.
So that's the beauty of fasting.
Fasting, blood donation,
Yes.
giving out something, that stimulates. Like olden days, I remember that, they used to put any hot rod on the human body, all such things they used to do. But I feel it could be to improve your immune system. But I'm not recommending that. But I'm telling it, there may be a basis on that. So giving blood, fasting is rekindling the immune system, the body systems to work more and efficiently. That is what is the basis behind fasting.
I think I'll take a final question because we have almost running out of time. Can a person with a low BMI still have toxins in the body?
Low body metabolic index. Okay, so low BMI. Again, I told you that low BMI, obesity, low BMI, and high BMI. All these are evidence-based ideas. They'll tell you that this is bad, this is bad, this is good, something like that. So nobody should feel that there were toxins within the human body. If at all they feel there is a toxin in the human body, they should go for fasting so that human body will go for autophagy and will remove all the toxins from the human body.
Yes, thank you. Thank you for clarifying. I think survival, that's the body's own system of survival. That's the basic part. If you don't believe yourself, your body, then no external help going to save you.
Correct.
So I'll request now Swamiji to make some few final comments or observations from the presentation. Swamiji, please.
Namaste. Very nice listening to Dr. Balakrishna Shetty based on his vast experience and evidence-based medicine, where we have to go for how to understand what wellness exactly is. So already has summarized. Let me repeat it. Yes, we all are looking for some evidences for our wellness or for our health, but already the wellness is in us. So follow our ancient ideas. Work hard, be happy. That's what he was focusing. So let us work hard, do good work, do good to ourselves, and do good to the society, and be happy. So wellness depends on your happiness. So whatever makes you happy, do that work with sincerity, and which should be good for you, for your family, and for your society. So that was very nice listening to Balakrishna Shetty, being a radiologist, connecting our ancient wisdom and talking with a lot of evidences. So it was nice listening, and thanks for being with us. Thank you, Dr. Balakrishna Shetty. Namaste.
Thank you. It's it's wonderful presentations and the summary of that. I'll request Anirban to make the final, propose a thanks to all the audience and our speaker. Anirban, please.
Yeah, thank you, sir. And thank you, Subhadada. Thank you, Dr. Balakrishna Shetty. And thank you, Swamiji, for a wonderful session once again. And we will thank all our audience as usual, as always. I'm sure they always join in. I'm sure that this will be really useful for all of us. So, I mean, I could see a lot of integrated wellness science and practice, the one which Swamiji and Dr. Sushil does. A lot of lessons from there, which I have acquired in the last 1 year. I've been with them to reverberate when you spoke about fasting, you spoke about so many other concepts. So thank you everybody for joining in, and thank you Dr. Shetty and Siddhartha and Swamiji once again to be with us and guide us and lead us through this wonderful session. Thank you very much. Good night. Good night, everybody. Thank you.